Hello at Medical Sciences. We are always privileged and we thank God for you that you have chosen our channel as your learning center and continue to inform others, those who haven't subscribed, liking the video and sharing it to many others. In this video today, we are looking at ESR, known as Erythrocytic Sedimentation Rate. So this ESR is a hematological test which is non-specific and is being used in monitoring inflammatory conditions. So ESR, the word E stands for erythrocyte, which means red blood cells. This one means RBCs, whereas sedimentation means the red blood cells clumping together, then falling to pack at the bottom of the tube. Then the rate is the time. So we are going to define ESR as the rate. By definition, it is the rate at which RBCs form rocks, then sediment and pack. And this one occurs within 1 hour. That is 60 minutes. This is what you can define as ESR. It is the rate at which red blood cells are able to form rocks, sediment, and pack in a tube for 1 hour when left undisturbed. So this one, the condition, the tube must be in perpendicular position, that is at 90 degrees, and it should be undisturbed. So meaning you should not place this tube on a bench with vibrations, and the bench should be horizontal without bending. That is what we can talk about. So this rate is measured within 1 hour. That is what we are calling ESR. For example, we are talking about terms like rocks formation, which we are going to explain more under phases. So with ESR, we are seeing if we collect our blood in EDTA tube, the time it takes for these RBCs in the blood to form rocks, that is to clamp together, then start falling to the bottom, is what we are calling ESR, and it should be in 1 hour. And what is the significance? Why should the doctor request ESR test? Though currently we are going to CRP. CRP is being ordered more than ESR. CRP is known as C-reactive protein, which also is used throughout inflammation. So with the significance of this test, majorly it is being used. First of all, it is non-specific. This test is non-specific, and it is being used throughout inflammatory conditions, any inflammation. So when the doctors request for you as a lab person to do ESR, know that they're interested in ruling out what we call inflammation or even tissue injury, if there is any tissue injury. But it can also be used as a prognosis. Prognosis means it is being used to monitor patients with chronic inflammatory conditions. So these are one of the significances why doctors can request for ESR. As we go on, we shall also look at different tests when ESR is raised. What are the conditions? So after covering the definition, we have seen the significance. Now let us talk about the phases of ESR. You can call them phases or stages of ESR. What it passes through for the red cells to pack at the bottom of the tube when collected and left undisturbed. And the phases include, the first one is rocks formation. We have rocks formation. That is the first one. The second one is sedimentation. You can call it sedimentation or aggregation. Then we have the last one, which is packing. These are the three phases of ESR. Number one is Rurox formation, number two is sedimentation, number three is packing. So the first stage, which we are calling Rurox formation, takes specifically 10 minutes. As we said, we are timing for 1 hour. So the first 10 minutes is to allow Rurox formation. And what is Rurox formation? It is whereby the RBCs clamp, that is, they come together to form stacks of coins. Stacks of coins. So in other words, you'll find RBCs which we know that they are biconcave disc in shape, coming to clamp together like stacks of coin. And so this is what we are calling Rurox formation. But we know that naturally, red blood cells, they have a negative charge, that if I have a red blood cell here, and this is another red blood cell, they have what we call a negative charge outside. So outside the RBCs, if this is one RBC, this is the second one, they possess a negative charge, and this negative charge is provided by presence of sialic acid. So this sialic acid, which is a glycoprotein around the cell membrane of an RBC, creates a negative charge outside the red blood cells. And this negative charge causes repulsion force. Now, this is the force that do not allow the red cells to come together, because we know like poles repel. So there is repulsion force, and this force created is known as zeta potential. Zeta, electrostatic zeta potential. So this zeta potential is created by the negative charge outside the RBCs created by the sialic acid. So for the Rurox formation to occur, there must be a decrease in the negative charge around the RBCs. So when the negative charge around RBCs reduce, then red blood cells move towards one another and clamp to form stacks of coins. And this process occurs within first 10 minutes of ESR. So after that, we go to the second step, which is sedimentation, or what we are calling aggregation. So when the cells have come together like stacks of coins, they begin now to fall in a tube towards the bottom. At that time of rapid falling, so there is rapid falling of Rurox forms, or the stacks of coin which have been formed during the first 10 minutes, they start falling rapidly towards the bottom of the tube, and this process takes 40 minutes. So this is the longest process in a tube, which takes 40 minutes. Then it ends with packing, whereby after the red blood cells, for example, in our illustration here, if the all RBCs have sedimented towards the bottom by the process of falling, and they have reached at the bottom, now they start packing together where there are some small spaces to be filled so that the packing is completed. And this packing is a slow process which occurs or takes 10 minutes. So this one is a slow process, whereas sedimentation is a rapid process where RBCs are falling. After falling, reaching at the bottom, they start packing together very well so that we can easily get the results. So this one also takes 10 minutes. So stage one, Rurox formation for 10 minutes. Step number two, sedimentation or aggregation, that is the 40 minutes. Then number three is packing, which is a slow process and takes also 10 minutes, making a total of 1 hour. So after looking at the stages, now we want to see what are the methods lab technicians or technologists or assistants are using to determine ESR in the lab? And the most common manual methods being used is Western grain. We have Western grain method, whereby we use the Western grain tube. Then we have the second one, which is the Winthrop. And with the Winthrop method, so these are the two methods we have. The first one is Western grain tube technique. The second one is Winthrop technique. With Western grain, this tube measures 300 millimeters, or you can call them 30 centimeters. But it is graduated from 0 to 200. Graduated or calibrated. So its total length is 300 millimeters, but the graduated part is from 0 to 200 millimeters. That is the graduated or calibrated. Then its bore size is 2.5 millimeters in diameter. And this tube, we use the blood which has been diluted. So before putting the blood in this tube, you dilute it 1:4. 1:4, not 1:4, but 1:4 with sodium citrate. Here the anticoagulant used is sodium citrate. So it means 1 part of the citrate with 4 parts of blood. So before filling it in a tube, this is how you dilute it. We used 1 part of the anticoagulant with the 4 parts of the blood. Then it is able to, so after getting this tube, it is calibrated from 0 to 200 millimeters. You dilute the blood 1:4 with sodium citrate. Then you fill the tube up to 0 mark. The tube is filled up to 0 mark. Then after filling this tube up to 0 mark, you come and place it. And during filling, you must make sure there is no bubble formation. And when you ensure there are no bubbles, you come and place it on a stand, on what we call ESR stand. So this is the tube. If this is the tube where we have filled the blood, it is pressed on the ESR stand on a horizontal bench. Vertically, that is at an angle of 90 degrees without bending. And if blood was inside, if this is a 0 mark, so you fill blood up to a 0 mark. Then without bubbles, then you leave it to stand. Remember, this tube is calibrated up to 200. So you leave it to stand for 1 hour. After 1 hour of standing and disturbed without vibration and away from sunlight, you come and we are going to see they are going to form rocks. If the RBC is present, are going to form rocks. They sediment and pack. At the end of 1 hour, we shall find there is a clear plasma left behind. So the cells pack. After packing in the tube, they leave behind the clear plasma. And maybe say this one stopped at 20. So what you do, after 1 hour, you come and read the ESR result at the meniscus, where the packed cells have stopped. And since the meniscus is at 20 millimeter mark, now our ESR is going to be 20 millimeters per hour. Why are we saying per hour? Is because we have left it to stand for 1 hour. And the rate it has moved is 20 millimeters. So the ESR becomes 20 millimeters per hour. That is how we are able to determine ESR using Western grain tube method. And this method is the accurate method compared to Winthrop. So compared to Winthrop, Western grain is very accurate. What about Winthrop method? With Winthrop method, this tube, it is 11 centimeters long and it is calibrated from 0 to 100 millimeters. So this one is calibrated from 0 to 200, whereas this is from 0 to 100 millimeters. Still, its bore size is 2.5 millimeters. And this one, we use EDTA whole blood. Here there is no dilution using sodium citrate, so we use EDTA whole blood. And we fill, after getting this, we fill this tube up to 0 mark. It is filled up to 0 mark, and then we leave it to stand in a vertical position for 1 hour, and we come and read the ESR results. One of its advantage, this one needs little blood compared to Western grain. This one needs little blood compared to Western grain because Western grain uses 1 ml. You require 1 ml of blood, whereas this one requires less than 1 ml of blood. This one requires dilution. Here there is no dilution with sodium citrate. And what makes Western grain to be most accurate? Because it is longer compared to Winthrop, which is shorter, as witnessed from the see, this one is a 30 centimeter or 300 millimeter. This is 11 centimeter or 110 millimeters. So these are the different methods which we can use in the laboratory to determine our ESR results so that we can rule out different conditions. After that, you can ask yourself, because we have seen the methods, what are the reference ranges? And reference ranges of ESR, they differ from sex and age. We are going to find out that the reference range of ESR for male, it can range from 0 to 10 millimeters per hour, whereas the female is from 0 to 15 millimeters per hour. Then elderly, those are people who have age greater than 60 years. This one can be 0 up to 20 millimeters per hour. So with male and children, it is 0 to 10 millimeters per hour. So these are the reference ranges which you can use during ESR determination. So after looking at the reference range, we are going to see what does it mean if I get results which are higher than the normal? And what does it mean if I get results which were supposed to be high, but they are low, or they are not high? So causes of raised ESR results include conditions like, multiple myeloma. Multiple myeloma is due to increased levels of gamma globulins. When there is increased gamma globulins, what we can call hypergammaglobulinemia, causes this cancer type, which is multiple myelomas. That is, the plasma proteins affected, especially the gamma globulins, and we can find it can cause highly elevated ESR results. Another condition which can do this is hyperfibrinogenemia, or what we can call increased levels of fibrinogen. If someone has increased levels of fibrinogen in the blood, what we are calling hyperfibrinogenemia, we see ESR raised. Then also people with the cancers, any cancer in the body can cause raised ESR. Then chronic inflammatory conditions, chronic inflammation. So chronic inflammatory conditions like TB, if someone has HIV, and plus any other disease that can cause inflammation in the body, they can result into elevated ESR results. Then other conditions we can add here is autoimmune disorders. Autoimmune disorders like rheumatoid arthritis can also lead to elevated ESR results, and sometimes also some types of anemia. can do that. So these are some of the causes. When you find ESR is raised, we can think. But remember, we said it is a non-specific test, meaning it cannot give you a clue on the diagnosis. It cannot tell you that this is the differential cause. So when it is raised, you have to go further to do other tests to confirm the cause of that inflammation. So it is more of prognosis than being diagnostic. And another thing, it cannot tell you the severity of the disease. So that is the ESR, which we say it is non-specific, but being utilized to rule out inflammation. Then what could be the cause of low ESR? You can ask yourself, we are saying the reference range begins from 0, but why do we say causes of low ESR? Why we are saying low is that it was supposed to be high, but due to the certain factors, it is low. And certain those factors which can cause low ESR result include polycythemia, that is high numbers of RBCs, polycythemia, increased RBC count, even dehydration, then sickle cell disease plus spherocytosis, like people with hereditary spherocytosis. So polycythemia causes falsely low results, dehydration, sickle cell disease, and hereditary spherocytosis. These cause falsely low ESR results. So after looking at this, we are going to end this video with factors that affect ESR results. What could be the factors? We have seen some of them here, but we want now to give them in detail. And this is the most commonly asked question to the students who are pursuing lab. We can easily ask you, explain 10 factors that affect ESR results, and we give it 20 marks. So how do you approach such a question once it is brought? So these factors that affect ESR results are categorized into 3. Here I'm categorizing them, but in an exam, you leave it open. So the categorization helps you to remember all the factors. And one of the factors here we are going to see is plasma factors. We are going to have plasma factors. We shall have red blood cell factors. We shall end up with technical factors. You can call them technical or mechanical factors. So these are the 3 factors we are going to discuss, but we have said in the exam you don't need to categorize them. And under plasma factors, we are going to see factors like plasma proteins. Then we are going to see plasma viscosity. With the plasma proteins, we have different types of proteins like fibrinogen. We have fibrinogen. We have globulins like alpha, like beta, like gamma. All these are globulins. So when these globulins and fibrinogen are elevated, all of them lead to high ESR results. So the ESR results go high. So we are saying plasma proteins like fibrinogen, globulins lead to increased ESR results. So if someone has high levels of fibrinogen, if someone has high levels of globulins, it can lead to high ESR results. That is what we are talking about. But if someone has, these ones were high. If someone has high levels of albumin, this albumin for it leads to decreased oral ESR results. So this one causes low ESR results. So high levels of albumin lead to low ESR results. This is albumin plus lecithin. So lecithin and albumin, for them they result in 2 rho, whereas high levels of fibrinogen and globulins leads to high. But also there is another factor which is cholesterol, but cholesterol is not a protein, it is a lipid. So if someone has also high cholesterol, they can result into elevated ESR results, but remember cholesterol is not a protein, so you can put it as alone. So that is what we can talk about point number 1. So let me call it A, B, and C. This is point number 1 about plasma proteins. Then point number 2 is viscosity, plasma viscosity. And we are going to see if the plasma is more viscous. Something which is more viscous, it means it is thick. And when it is thick, the rate of sedimentation is going to be low. So the rate of sedimentation of RBCs. So highly viscous plasma leads to ESR, to low ESR results. Why? Due to low sedimentation of RBCs. But if the plasma is less viscous, the ESR or the rate of sedimentation will be high. That is how you can discuss about plasma viscosity. So that is part A, about which we have discussed about plasma. Then part B is about RBC factors. RBC factors include, we're going to talk about number, you can call it population. We are going to talk about size, stroke mass. Then we are going to talk about also shape of the RBC. So this is going to be point number 3, point number 4, point number 5. So about the number of red blood cells. If someone is having high number of RBC, which we call polycythemia, the rate of sedimentation is going to be low, hence leading to low ESR results. That is in polycythemia. But if someone is anemic, anemia means low RBC count. If someone has low RBC count, those few RBCs are going to sediment faster in plasma, leading to elevated ESR results. So this is how we can discuss in 2 ways about the number of RBCs. If someone is polycythemic, what happens? If someone is anemic, what happens? Then another one is about the size or mass. If someone's RBCs are small in size, that is microcytes. These microcytes, because they are small in size, their mass is also low. And when the mass is low, due to their smaller size, the rate of sedimentation is also going to be low, leading to low ESR results. So you find if someone ESR was supposed to be high, due to this factor of the RBCs being small in size, is going to affect them and they end up being low. Whereas if someone's RBCs are big in size, those are macrocytes, or you can call it microcytosis, means the RBCs are large in size. Because they are large, their weight is going to be high, or the mass is going to be high. And when the mass is high, the rate of sedimentation is also going to be high, leading to elevated ESR results. That is macrocytes. So this is the explanation you can give under the size. Whereas about the shape, some shape we can call them presence of poikilocytes. Poikilocytes or poikilocytosis means the variation in shape. So if you find someone has poikilocytes, for example, sickle cells, someone has poikilocytes like spherocytes, these poikilocytes are going to cause false low results. How? Sickle cells, sickle cells, they are sickle in shape, or they are banana in shape or bean shaped with a sharp end. And because they are in this shape, some are like this, so the packing is going to be not easy. So when these cells, because they are of different shape, on packing they leave spaces. And hence, because they are leaving much space, the ESR ends up being low. So presence of sickle cell leads to low ESR. And this one is due to the poor packaging of the RBCs. And of course, even when these cells, when they are sickled, they don't tend to aggregate faster or to form rurocks, hence also causing low ESR results. Then with the spherocytes, these ones are majorly formed even when blood is left to stand for long at room temperature. And when it is left for long, it loses its negative charge, reduces. But as if this is not enough, also, the normal RBC, they are biconcave disc in shape, which facilitates their rurocks formation and packaging. But these spherocytes remain round with no area of central pair. So if they are remaining round, when they are packing, spaces, big spaces remain in between, and they cannot form rurocks very easily, hence still leading to false low ESR results or low ESR results. That is what we can discuss about the shape. So lastly, that is part C. As we wind up in this session, hope you guys, you are enjoying our video. And please, if you are following very well, don't forget to like. If you haven't subscribed, please go back and subscribe. It is free of charge, and this one enables you to always get updated. So with the technical factors, or what we are calling mechanical factors, these are the errors done by the lab technician, either during collection, during analysis, and even after analysis. And these errors include position of the tube, position of the ESR tube. We can talk about presence of vibration. If the bench has like a centrifuge, we can talk about temperature. Temperature, that is, maybe you are running ESR in direct sunlight, hence raising the temperature. Then we are going to talk about the age of the specimen, the age of blood. Then we can talk about even anticoagulant ratio. Anticoagulant ratio. So these are the factors we are going to talk about. This is 6, 7, 8, 9, 10. So if they ask you to explain 10, this is how you can outline them. How does the position of the tube affect? The ideal, the tube should be vertical. That is at 90 degrees without any bend. So if the tube is tilted, any tilting of the tube, if there is any tilting by a mere tilting by 3 degrees, this one causes elevation of ESR by 30 millimeters per hour. So we must always ensure that the position of the tube is vertical, or it is at a perpendicular angle which is 90 degrees to prevent raising of the ESR. So when it is a straight ESR, you get normal results, but bending of any bending of the tube lower increases ESR by 30 millimeters per hour. What about vibration? Vibration leads to low ESR results. How does it happen? If you are put your ESR stand on the bench with constant vibration, it does not favor rurocks formation and packing because the cells remain being suspended in the plasma, hence leading to low ESR results. So that's why we ensure that among the precautions, it should be done from the bench without vibration created by the centrifuge. What about the temperature? The ideal temperature should be between 20 to 25 degrees centigrade. So above 20 and below above 25 and below 20, that is high temperature causes high ESR results. Because when you increase the temperature, you reduce the viscosity of plasma and increase the movement of the RBCs, hence leading to elevated results. Whereas when the temperature is below 20, that is low temperature, you get low ESR results. What about the age of the blood? If you have left blood to stand greater than 2 hours, meaning the ideal or the precaution, blood used for ESR should be freshly collected. So using blood collected after 2 hours at room temperature, it will lead to false low results because these blood cells will end up forming spherocytes and created RBCs, which will lead to low ESR results. Then anticoagulant ratio, if the ratio is high, because the ideal should be 1 to 4. So if the ratio is high, it will affect the results of ESR. So these are the factors we can discuss with you. Some textbooks go ahead to give factors like age, factors like sex and age, whereby children and elderly ESR is high, whereas the one in the middle age, that is the adults, you find they have low ESR. Then we see ESR raised in female than in male. So sometimes they add this age and sex as also factors. So if you have failed to raise all of these, you can always add the age and the sex, though they are not good factors to give as the first point. So hope you have learned with us and you are able to know the sources of error. So if these ideals and the technical factors are not done, they result into what we call sources of error. So if they ask in an exam outline any 5 sources of error during ESR determination, you can always include tilting of the tube, presence of vibration, performing in direct sunlight, which will increase the temperature, using hemolyzed sample, using the sample which have taken long at room temperature, then failure to mix the blood with the anticoagulant can be a source of error. So thank you so much for learning with us. Hope you have followed us from the beginning up the end. And if you have enjoyed our video, please share to many others so that they can continue to learn from us. May God bless you.